Welcome back. As we get into the second hour, let's have that most important discussion concerning blood donation and the true voluntary blood donation drive. The health minister would have mentioned over the weekend that they are, again, making the call, the ministry collectively and all the top officials, from doctors to nurses, they're making that call for people to donate blood voluntarily. They're asking for at least a 20,000 army, and that should be enough if people are giving on a constant basis. And to really advance that conversation, we welcome Director of the National Blood Transfusion Service at the Ministry of Health. Of course, Dr. Kenneth Charles is with us on the Zoom line, and also with us, Senior Head Nurse at the Sandy Grande Hospital, Diane Patrick Waterman. Welcome, and great to have you on this morning to advance this most important discussion.
Thank you.
Good morning.
Good morning. So I recognize the newly renovated blood bank, the blood donation center. There was that big rollout over the weekend for the North Central Regional Health Authority. I want to, again, just give you the opportunity to remind folks how important it is, because it's only when people end up in hospital, either for themselves or with a loved one, they recognize the importance of blood and how I get critical it is at that point in time. And it's only then you're calling family, friends, everybody to try and donate. But we want people to come in their regular time to just give. How can we get that conversation going? How can we dispel any fears? I'll probably start with the doctor first. Go right ahead, Dr. Charles.
Thank you. There's a historical perspective to it, and it lies in the definition of a voluntary, non-remunerated blood donor. And this type of blood donation means somebody donates blood voluntarily. It is not intended for any specific person. It is not done under pressure by relatives, friends, the health system, and there's no remuneration, meaning payment in cash or kind. And this was introduced in Great Britain in the 1920s, and before it was, what existed was a blood donation system like we have now, where people scramble for blood donors whenever they need. And it was changed in 1920s in Great Britain, and after that it was spread throughout cities throughout the world. But sadly, the technology and the methods were not passed on to some colonies, for example, ours, and countries like India, Africa, and so on, which have developed systems based on family replacement blood donation. And the consequences of that, you described well. There's shortages, there's problems locating blood. What we collect is inadequate, because people donate only when they're in an emergency rather than regularly and on a frequent basis. So there's always a shortage. And with the ongoing entitlement that is given in our current systems, the chips and credits, it means that whenever blood is donated, it has a shelf life, about a month. And therefore, there's always a mismatch between the number of chips or credits and accounts. And there's often disappointment and dissatisfaction with the system. But generally, the system, it does not work, it cannot work, and it has not worked. And I invite our listeners and you, Mr. Williams, to just check voluntary, non-remunerated blood donation. You Google it if you wish, and see that it works in countries where it is practiced, and any country that does not do it has the same problems that they have.
Understood. Because I'm watching that the ministry is suggesting that 40 to about 60,000 pints of blood, that's the benchmark, that is what's workable in a year, in a given year. And they're trying to, put plans in place to get that. Where are we right now, though, in terms of our blood intake yearly? How far behind those numbers are we?
Annually, about 20,000 units of blood are collected.
Wow, so you need to double up and triple up in
yes,
in
and
regard.
it's not just doubling up or tripling up, because if we double up and triple up and maintain the same conditions of engagement, there will still be inequality and unequal access. We'll have the same problems. The solution lies in having the blood donated voluntarily and not linked to anybody, not linked to the donor, so the donor doesn't decide who gets it. And therefore, if we increase it to 40,000 and change the terms of engagement, it will be equally accessible to all the patients in need, including cardiac surgery patients, everybody. There'll be no need to stress the families because this blood is donated with no conditions attached.
Okay, let me bring this Diane Patrick Waterman into the discussion. On a daily basis, you being their head nurse and talking to your staff and working on the ward, on average day, how many people will come in and really need that blood? And what are some of the ailments or some of the conditions where blood is needed as of today to ensure this patient can survive?
Right. Well, our donor flow sometimes could be like around, let me say, 12 to 15, right? Various institutions, maybe a little more, right? The persons who may require a unit of blood sometimes are pregnant women, accident victims, persons with blood disorders, it doesn't matter. A lot of persons require a unit of blood. As a lecturer used to tell us, the real world is in the hospital. People go through a lot. They cry out a lot. And nurses and doctors are not the only hero. We are pleading with the nation. They can be a hero to at least help, because 1 pint can save 3 or more lives.
Yeah. What about folks with gunshot injuries? You know, those who come in under bullet. I know obviously everybody in that moment, you will try your very best to save everyone, but is there that particular rush also for those
Yes.
victims?
Yes, so hence the reason Dr. Charles and I, along with the Ministry of Health, we are trying to beef up on the amount of units of blood, because in case of emergencies, blood cannot be cleared immediately. So what is already there in the pool that is already cleared will be going directly to that victim, right? We don't choose. Once we go according to priority. So for example, for a gunshot wound, and we know that that person is hemorrhaging, we attend to that person immediately, and blood is a dying need.
How does one become a blood donor? Let me probably bring the doctor back into the discussion, because there are those looking on, and they want to be part of this 20,000 strong army that the ministry is suggesting, and they're trying to get to come out and give blood on a regular basis. What's the first process? How does one sign up and get the ball rolling?
First, all that is required is a good heart and an intention to give and help. And we think most people in Trinidad and Tobago are that way inclined if given the opportunity. And because if one wants to enroll in that way, I mean, one should make the commitment first to donate blood for no strings attached and for anybody in need, because that's the only way the system will work. Then now we are trying to phase out the pre-existing systems of replacement and remunerated blood donation. And so the 3 options are running side by side. But I want to suggest to fellow citizens, and I'm saying this because I'm a previous blood recipient having survived a horrific road traffic accident, and I'm also a voluntary, non-remunerated blood donor. And because of my work, I see people in need every day, and I see the horrors they go through. And the only solution, the only real solution, is to become a voluntary, non-remunerated blood donor. And that for now can be done through the Ministry of Health by visiting its website and registering or signing up as a voluntary, non-remunerated blood donor. It is a safe option, and it's the option that is consistent with all our beliefs. It's consistent with Dharma in Hinduism, it's consistent with Sadhaka in Islam, it's consistent with Christian charity, and it is respectful of the wishes of the Jehovah's Witnesses who, for religious reasons, don't subscribe to blood transfusion. We respect that, and we don't use blood willy-nilly.
Yeah.
So it's going to the university's website or going through one of the donor organizations. We plan to start in all the communities in the country. Go to them, join them, and register as a voluntary, non-remunerated blood donor so we could reverse this imbalance after 60 years of independence.
I want to thank you, Dr. Charles, and I know that it's a very important discussion for you because of your vocation, but also from a personal standpoint based on what you just mentioned. Thanks for sharing that most personal story with us, and you also being here today as a recipient of blood when you got into that unfortunate vehicular accident. I want to also thank Senior Head Nurse at the Grandie Hospital. If ever folks at the Grandie, you could ask for her by name. I send people your way. That's Dion Patrick Waterman. Thanks for coming on.
Correction, Dion.
Oh, Dion.
After Dion Warwick.
Dion, like Dion Warwick? Apologies. Dion Patrick Waterman. Nurse, Doc, thank you so much for coming on. All the best.
You're most welcome.
Thank you. Same to you. Bye-bye.
For sure. We come back with the Health Plus. Another doctor joins us, this time around Dr. Safia Mohammed, to give us the latest. Stick around.